so much for joining us today, Aliya.
No problem.
It's wonderful that you decided to take part in our Patient Insight series, and this is focusing on the Breaking Down Barriers project, which looks to improve inclusiveness and accessibility for all patients and families into healthcare services. So could you please tell me a little bit about yourself and your role at Bradford, please?
Yeah, so my name's Aliya and I'm one of the metabolic nurse specialists for the paediatric patients here in Bradford. So we're an outreach branch from the Manchester Metabolic Service, and we cover quite a vast majority of the Yorkshire region, and we look after patients from birth, from diagnosis to the age of 60 until they get transitioned over to the adult metabolic service. Part of our role here in Bradford, we're a team of 4 metabolic nurses. Our job role sort of consists a lot of home visits. We sit in all of our patient clinic appointments. Our clinics are multidisciplinary team consultation, so you've got your consultant, dietitian and the nurses there when we're seeing our patients. We do a lot of work with schools and nurseries. We do a lot of training in the community, and we support the families with their management and educating them. And then also what we've been putting a lot of work in recently is trying to educate and help our adolescent cohort of patients from the age of 13 to 16 on managing their condition and sort of preparing them for when they reach 16, when they go to the adult services. So that's our vast sort of job role, and it can vary. We do a lot of, there'll be some weeks where we'll do a lot of home visits and a lot of support, and there'll be some weeks where we're very office based and doing a lot of sort of office type work. So it varies a lot.
Wow, that's wonderful. Thank you. And how do you promote diversity within your centre at Bradford?
So I'd like to believe that we do promote it quite well. We try to use other agencies where we need to. So if we, Bradford is very diverse, and the surrounding areas of Bradford is a very diverse community. So we see lots of patients with who speak lots of different languages. We have a language line, and we have we have an interpreting service, which we tend to find that we use quite a lot, and we depend on them quite a lot. So that's one of our main things. Another thing, if we do find that we have families that are struggling, whether that be language barriers or cultural barriers and beliefs, we do tend to do a lot more home visits and support them families more than the rest, who we feel are not struggling so much.
Great, thank you. And what would you say are the main challenges of people from BAME communities accessing medicines and services as well?
Overall, in Bradford, I find it's quite good. We don't seem to see a lot of challenges. But however, we do have the odd few where we will find it's a bit when they understanding initially when we're given diagnosis and treatments. Sometimes there is a barrier there, and trying to overcome that barrier. I think education is key, and being consistent. So we're always telling this, educating them the same that we did the first time, and just supporting them and trying to be have that empathy with their beliefs. They can be a lot more different, a lot of cultural involvement. A lot of the families have a lot of extended families, so it's not your typical parents and just children. So you might have grandma or grandparents, aunties, uncles, extended families that also want answers, that also want a bit of education. So we do have consultations where we invite them along so that they can hear from the consultants and the health professionals, so that everyone is sort of singing up the same hymn sheet, really. We try to go for that sort of approach and get everyone to with consistency. It's sort of saying this is the management, this is the treatment, and that's the way we're going to go. So there's no cutting corners, and trying to do that in a respectful way, which we try to do, because again, it is a lot of cultural beliefs when a lot of families may want to try other methods, herbal methods, or we have occasions where they may want to take them for treatment abroad. So it can vary. And when I am saying this, it's probably from years and years, a handful of patients. So it's not something that we see all the time. Like I said, majority of the times, our patients are very good in the BAME community, and they work very well with us.
That's wonderful. And is there any other methods that you use to overcome any sort of challenges or barriers? I know you've already mentioned an awful lot there.
I mean, me personally, I occasionally, if we feel that we're not we're not proceeding so well with the families, then we do have a safeguarding list of patients, which then sometimes we do have to have that conversation within our team to see, is this going into a safeguarding matter? Because at the end of the day, we, as health professionals, we need to see the child's best interest. And although we have to respect cultural beliefs and communities and how they work, we still have that responsibility as health professionals to ensure that our children are getting the best treatment that they need to be getting. So if we really was struggling, there have been occasions where it has been discussed. From my experience, I don't think we have actually had to take any action down the safeguarding route. Majority of the time, a lot of engagement from ourselves and building a relationship and building that trust, I think, is really important, and that has tended to sort of worked, but it's keeping an eye on that cohort of patients and the families and making sure they're engaging and making sure that we are doing those home visits and we are sort of breaking down that barrier with them to show that we're actually here to care and we're here with support. A lot of our sort of BAME community families, we find, are very private and want to keep things within the family, and they don't like to ask for help or take help. So if there's occasions where we find anyone is struggling, and we are trying to offer that there are agencies out there that can help, whether that's a support worker or anything, a lot of the times they don't want to do that, because I think that's their cultural belief, and it's just something that they like to keep quite private, which we do find challenging. So yeah, safeguarding, we do have a database with our patients on there, and occasionally it may be that we do need to have that conversation within the team, and within our safeguarding team, we have a safeguarding nurses team here in Bradford on site, so we occasionally give them a call and seek a bit of advice from them and see, because sometimes it's quite nice to get someone's point of view, not from the metabolic world, someone seeing in and sort of getting that second opinion. Wonderful. And yeah, we'll just get a bit of guidance from them as well.
Thank you. And going back to your work with young people that you mentioned earlier on, what do you find that their challenges tend to be in terms of accessing services?
I myself, at the team of 4 nurses, I am the one that does the clinic. So we do a nurse-led clinic, which is sort of trying to do 13 to 16-year-olds. The cohort is quite large, so we are struggling to get the younger 13-year-olds in. So at the moment, it's sort of 14-year-olds, where we're doing a document called Ready, Steady, Go, and it's a national transition document that we fill out, and that it's like a tick box sort of sheet, which is a holistic approach. So it's not specific to do with metabolic conditions. So it's a holistic one, seeing how independent the teenagers are, and that's including sort of general life. What I have sort of seen, I've been doing these clinics and working with these young children for about just over a year, I'd say, and I have picked up on a bit of a pattern where there's questions about independence. So for instance, things like making your own breakfast or making your meals, or being able to catch public transport, socialising with friends outside of school. Those are sort of the questions I tend to see the children from the BAME community is more of a no. So they're a lot less independent. A lot of the times they won't know how to catch public transport and go into town. That's one of the questions: are you able to get into town on your own? Which they tend to go with family, which I find. And then another one that I tend to see is a lot of them don't have their own mobile phones, so they're not able to access, because I believe Metabolic Support UK, I'm not sure whether you've actually produced the app, but there's an app that was being produced for young teenagers to use to help manage with their condition and get a bit organised. I mean, we do find alternatives. So when they do tell me that they don't have a mobile phone, they do have access to one, so they'll have access to their parents. So I'll be like, download that app, or there's various other apps that can help you to organise yourself and put your blood levels and things in. So we do find our way around, but I do find that there is a little less independence. A lot of the times I find with the males, teenagers, they're a lot more dependent on the females in the family. I think, again, that's a cultural thing where if I would ask a question, if you're able to make your breakfast, and it'll be like a laugh, like, no, we don't do that in our sort of family. So things like that, I do find what I have seen in the last sort of year, that there's not as much independence, and there is a little bit of I wouldn't say it's a problem with accessibility to sort of like apps and things. We can work our way around it, but it's not as easily accessible as the children not in the BAME community.
Okay, thank you. Do you think there's anything in general that healthcare services could do to improve the accessibility?
I think sometimes when we have new diagnosis and we are giving out information which is generally written in English, I think maybe we need to explore that option a bit more to see if, I would have thought there probably is an option of sort of literature in different languages, but that's never out there. It's never something that's ever been brought out as an option, or I've never really heard of sort of any leaflets in different languages, which I think, again, in Bradford we have a lot of patients with lots of different languages. Yes, we use interpreters. We tend to get interpreters to write things down sometimes, but I think it'd be quite good if we could get some of our we have temple booklets, whether we can get that in different language. I'm not sure if we can or not. It's something that I've never explored. Maybe it's something that we probably could explore, because they're really good information for parents, and it's very in simple language in English, but if we could get it in different languages, I think that would be good. Also, sort of one of our main treatments in metabolic medicine is an emergency regime, which is a step-by-step guide on how to make up a medicine. Whether we could get that in a different language, I think that would work wonders. Really, I think it would really help. It's just the little things, I think, sometimes, but it's something that I don't think we have explored here in Bradford, and whether that's something that would, I do think it definitely would help.
Wonderful, thank you. What do you think the impact of being diagnosed with an inherited metabolic disorder has on a person from a BAME community?
I feel that they may feel that they're being judged. I do feel like there is a bit of that stigma and sort of around with a lot of the BAME community. They do it's quite cultural for them to marry within the family, and I feel that that's where they may feel a bit judged. That is one of our questions that are asked in the initial consultation to any of our patients, or all of our patients. So sometimes I do they feel that we're asking because they're from a BAME community, but it's something that we ask all of our patients regardless of their ethnicity. So I do feel that there is that bit of, they may feel a bit judged, or they may feel a bit embarrassed. There is that bit, and it's just sort of trying to make them aware that it's just a standard question that we ask everyone, and just sort of reassuring them. A lot of the times you do get some mothers that will ask the question, and this is not just in sort of your BAME communities. You do get a lot of parents feeling that, blaming themselves with inherited conditions, because obviously it's something that's passed on. But a lot of the times, if it is a couple that are related or closely related, they do feel that it's their fault with the partner that they've chosen. And it's just, again, supporting and educating them that we all have faulty genes, and it's just bad luck when two come together. And again, it's not like it would definitely happen. There's still that 1 in 4 chance. So it's just sort of educating them and just showing them that, it's not their fault, and just sort of having that sympathy and being there to show them that they're not being judged and it's not something to be embarrassed about. But I do feel that there is that bit of a sort of they feel that they're being a bit judged or.
Great, thank you. It is just that reassurance.
Yeah.
What do you feel that charities or patient organisations can do to support clinics such as Bradford going forwards?
I feel with Metabolic Support UK, when I was initially, before this pandemic, doing the transition clinics, we were obviously doing them face to face. A lot has changed in the last 6 months where we're doing them virtually. I did have Metabolic Support UK coming in and speaking to our patients who are at the age of transition. That worked really, really well. I'm hoping for that to move forward when we can, obviously, once we're over this hurdle, whenever that be. I feel like if charities were a bit more there when it comes to initial diagnosis, I think that would help. I do find with PKU, you've got the NSPKU, which they have like a lot of leaflets and a lot of sort of information and things, and a little bit about their charity, which I think in Bradford we tend to send out to our PKU patients as like a standard what we do. So after they've had a diagnosis, after a few weeks, they get like a package and they get that sent out to them. So something like that I think would work quite well, just so that these parents know that we're there, because I feel you're a really, really good charity. You do a lot of work, and I feel like a lot of people don't know about you, and I want them to know about you because you do a lot of good work. And I've worked with you for over a year now, and I've sort of told all my young teenage patients about you and the app and things like that. So I feel like we're getting out there with the teenagers, and if we could get a bit more with the parents, and I think that would be with when they're a lot younger, when they're being diagnosed, I think that would be really good.
Absolutely.
Well, that's, even if that's just a leaflet that we have that we can give to them after a couple of weeks, because we tend to see them quite frequently when they're initially diagnosed. So obviously letting the news sink in and letting them get used to their new lives with us being around, and then it'd be something that I think would work quite well. And it's there, it's an option that's there, and if they want to use it, they can use it. And if they don't want to, a lot of families don't like to, then that's up to them.
Yeah, it's just making sure that support's accessible to them, and that they know what we do as well is important.
Yeah.
Thank you so much. Is there anything else that you would like to add? Is there anything else that you would recommend?
No, I don't think so. Like I said before, I feel like you're an amazing charity. I've been to conferences, and I think you do an excellent job. So yes, just carry on.
Thank you so much, and thank you so much for your time, Aliya. We know you're busy, but thank you for giving up your time to do this interview and for sharing your insight as well. So thank you.
No, that's fine. Thank you.